My name's Aaron. I was going to do a quick video on tearing or rupturing your Achilles heel. I have not been to surgery yet. I ruptured mine a week ago today. I'm scheduled for surgery in a couple days, and this has kind of been my experience working through this at this point. So if you've hurt yourself and you know it's a ruptured Achilles, then here's maybe some tips that'll help you get through the pre-surgery time period, because I guess in some cases it could actually be weeks. I have found that as soon as I injured myself, I iced it that day, and then I went to heat after that with a heating pad, just kind of keeping my leg up, trying to get the blood to not pool in my lower extremity. I use ace wraps, starting at the top of my calf and kind of working down to kind of hold my calf down, because once that separates, now your calf is trying to retract and that hurts. And I found the ace bandages throughout the course of the day, one on my upper calf and then one around my foot and ankle to keep that from swelling. Made a big difference. The other thing I did was I went onto Amazon and got one of these boots. It was only 45 bucks or so, and because I have to go to work, I put the ace bandage on and then put the boot on, and then I got some crutches like these from CVS. I think they're only like 50 bucks, one size fits all. And I use just one crutch and the boot on the side where the leg is hurt, and I'm able to get around pretty easily that way. There are times when the pain is intense. Just the other night it was really killing me, and I don't know why for sure, but I was looking for something stronger than the non-prescription stuff, if you know what I mean. But usually after I take a couple ibuprofen, take two, it's labeled for two, in a half hour or so, the pain really does dull, and you can function again and kind of start to get some sleep. When you are sleeping, I keep my leg wrapped for one. I tried using the elevation method, thinking that might keep it feeling better, keep the swelling down. What I found was when I elevated it, now I got to rest my calf on top of the pillow, and that hurt a lot more than lowering it and maybe letting it swell a little bit. But with the ace bandages on there, it never got too bad. So what I have found works well is I take a regular pillow, put it down between my legs. When I roll to the right, I put my left leg up on top of it. It supports my calf on the side, on the shin. When I roll the other way, I just take it off, and I've been able to get much better sleep that way, because I just don't sleep flat on my back like some people might do, but I kind of toss back and forth. So that pillow there has made a nice difference. As far as the ups and the downs, sometimes it's it just doesn't hurt. It hurts to walk, obviously, but just sitting around kind of pain isn't bad. There are other times, like I said, it's pretty intense, and started shaking a little bit the other night because it was hurting quite that bad. From what I understand, the pain's pretty bad after the surgery, and I opted for the surgical option versus the non-surgical option, which I'm told is just pointing your foot basically for 6 weeks, and eventually the tendons will grow back together, and then you start rehab after that. And that seemed a lot slower to me, so I'm going to go get the surgery in 3 days, get it tied up, and then get back to things. So hopefully as I come out of surgery, I'll have an update for you and kind of let you know what that experience is like. But hopefully these tips will help you get to that point and manage the pain in the process as best you can. And we'll see you on the other side. Thank you.